is our product. It's called PTCommuniverse, short PTC. It's an innovative physical therapy technology. The issue that we decided to focus on is home maintenance for physical therapy, and PTC would increase convenience. It would increase safety, so that means that the exercises in the clinic would be done at home in a safe fashion. Also, it would alleviate some anxiety that's associated with home maintenance exercise and PT rehabilitation. Also, athletic rehabilitation would be enhanced. It would treat children through the gaming system, and it's an efficient and effective treatment for physical therapy. Our target audience we decided to focus on was busy individuals, so people who can only maybe go to the clinic once or twice a week, and also athletes returning to sport, as well as children who are receiving physical therapy care.
Just a couple of facts on PTC to get started here. It's a virtual reality physical therapy system, and it uses a variety of technology, including voice recognition. So that's how you talk to the computer, that's how you make your decisions, that's how you get the application started. It will provide personal feedback in the form of how you're doing the exercise. Provides specialized treatment, so you and your therapist can work together concerning the feedback results and alter your treatment plan as necessary. It's used for both the home and the clinic use, so it will provide continuity between your therapy in the clinic and your therapy on your off-clinic days. It's going to have multiple applications, so there'll be a variety of things you can do with the technology, a bunch of different stuff you can do with it. And we're also going to include a patient security aspect. So the therapist will have a login at the clinic. No one else will be able to access your results or see your progress. Some of the benefits of PTC, it's going to provide real-time results. So as in the picture here, you can see exactly how you're doing the exercise. You're seeing your progress up to the moment. It's very convenient. You can do it on after work, before work, after you pick your kids up from practice, whatnot. So there's a variety of different times. You do it at your own leisure. Provide safety. I know we talked a little bit about this earlier, but it does allow you the comfort to do it in your own home without losing any of those safe components that you get with a therapist. The technology will show you the proper form and technique to do each of the exercises and stretches that need to be done. You can communicate with your therapist directly, both through the results and through a real-time camera system that we're developing, very similar to a Skype or FaceTime technology that you might be familiar with. It would also reduce the number of visits to a clinic. So we know, especially with certain insurance policies, you only get a certain number of visits or hours per year. So this is definitely going to help with that, and especially people who just simply can't get to the clinic 3 or 4 times a week. Some of the technology we're using, first and foremost, is the avatar. It's going to provide movement feedback. You're going to see yourself exactly making movements on the screen. Also the wireless electrodes that we've been working with a company out in California, development here. The wireless electrodes are going to be used on your specific injury site to provide feedback to that muscle group, exactly how it's moving. The telehealth communication that I briefly touched on, in any case that you feel unsafe or unsure about an exercise, you have the option to basically call into the clinic, and if the therapist is available, he or she can communicate with you through face-to-face technology. And it's also going to have a voice recognition system, so like I said, that's how you're going to command the system to do exactly what you want. In the clinical setting, it's going to provide a fun and exciting type of therapy. So 2-3 months in, you're doing the same thing every day, it gets pretty boring. This is definitely an alternative to that to keep things new. It especially allows the therapist some flexibility. A lot of therapists in open clinic are seeing multiple patients at one time, so it really provides them with the opportunity to treat a couple patients at the same time. It does record your progress, so instead of maybe handwritten notes or whatnot, or just having the patient have to kind of mentally keep track of where they are, this will have a statistical progress recorded for you after each treatment session. Especially going to help in the latter stages of recovery when you get towards that release from treatment, to really know exactly where you are and what things you need to focus on to complete your treatment. And also a fun aspect of it is a patient-to-patient interaction. So in the clinic with other patients that maybe have similar treatment programs or at similar stages of recovery, you might be able to play a game with someone else in the clinic, again making it a little more fun to be in therapy. At home, like we stated earlier, you're going to provide convenience to do it at your own time and leisure. A little more motivational. You don't have to get up and go to the clinic. You can do it at home whenever you feel you're at your best peak opportunity to do the therapy. It does provide a goal-setting technique. Safety, again, is a big part of this technology. And with the telehealth component, you can talk to your therapist at any time if he or she is available to make sure that you're doing everything correctly. This relates to athletics. We think this is definitely going to be an awesome cutting edge for athletes. Provides sport-specific training. So for instance, a soccer goalie who is nearing return to play can actually use this technology to simulate the same movements that he or she will use in a game in practice. So you really get a specific feedback onto exactly how your progress is related to your sport. It's going to provide a little more efficiency in getting back. You get into those later stages of recovery where maybe more basic treatment programs kind of have the same standardized thing. This will allow you to really specify it not only for your sport but individually as well, so you get back a little bit faster, you're doing exactly what you need to get back. The electrodes really come into play with the statistical feedback. It's going to show that muscle area, muscle group, the exact speed, agility, and strength of the muscle. And we're also going to offer a post-therapy maintenance program. So after you've done your clinical therapy, you can take home some software. You can keep going with this, you can keep tracking your results.
Our financial cost for this system will initially be $15,000 for development and $5 for each electrode, which is a bracket of 4. For patients' costs, we're working with insurance companies to decrease the overall cost of physical therapy, and it will be $30 for home webcam and the $50 for continuation of the software that will update itself every month. Our training, we've been working with Dr. Hinman. She's been helping us develop the technology to make sure that it's patient-friendly and that it meets the physical therapist requirements for exercises. We will have a PTC specialist for in-clinic education who you can go to with any problem, and they'll be the head person who will teach everyone. Recommended education program for patients. The PTs will teach the patients how to use the software before they go home so they're more comfortable with it and they don't have any problems when they get there. We started research testing at Boston University. We've worked with athletes closely so far, and we want to focus on them first and then bring it to a wider variety. Our estimated initial cost, is $500,000 for software maintenance, training, and research.
To evaluate our product, we're going to look at patient compliance and the recovery time that it takes for patients to complete the recovery and rehabilitation process. We're going to look at performance and measure how quickly patients are able to peak in their performance. We're going to look at how therapists evaluate their patients' progress as well as their own opinions on how the system is working. And then we're also going to look at the financial aspect as well to see how much money we're going to be saving, communicating with insurance companies to actually calculate the exact price of what we're saving by shortening the number of visits. And some of the related technology that we have based our PTC system on include Gesture Tech IREX, which is avatar technology that measures the biomechanics and kinematics of motion and movement. We've also looked to Connect, as well as Nintendo Wii Fit, and as discussed earlier, are working with UC San Diego, developing a wireless electrode technology for us to use. And we've identified 3 major barriers to entry. This one is the integration aspect and how we're going to integrate the system with specific populations that might be more resistant to this change. The elderly may have a more difficult time adapting to newer advancements in technology and may have trouble adapting to the video gaming system. To address this, it just takes persistence and patience on the behalf of the PTs working with them to ensure that everything's going smoothly and safely. Secondly, the expansion into various types of clinics can be a barrier, especially in inpatient settings and hospitals. And lastly, affordability. Initially, insurance companies might resist wanting to cover the system for their patients. And as far as marketing goes, we have a website, www.PTCommuniverse.com, with all of our product information, and we will be attending APTA conventions, and we'll be utilizing social media such as Facebook and Twitter to spread the word of our product to other clinics and universities. We'll be spreading the word at Boston University, at Sargent College, at the Ryan Center, and with a lot of the athletes here at BU.
Some future work that we have in store is expanding the patient network to other populations such as pre- and post-surgical operations, persons with disabilities, that's physical, neurological. We're looking at new therapeutic techniques and advancements, updating the system just in terms of new research that's out there. And also, we'll be updating our software to more personalized avatars so it looks like the individual, as well as updated graphics, and also a personalized voice feedback, so we'll be able to implement a voice, either the therapist or someone else that's been motivational in the person's life that will help them with their physical therapy. In conclusion, that's our product, PTCommuniverse, and it's an innovative physical therapy technology that will have a great webcam feature, and we hope that you invest in our product because we think it's going to be really great. Thank you.